Hello, everyone. So we are going to actually talk about post-op care for our patients under surgery today. We'll first talk about our recovery. So a lot of this we've already talked about in anesthesia, but we'll just kind of reinforce some things. So when we're extubating our patients, we are going to, or before we extubate our patients, we're going to obviously turn off our vaporizer. Um, so especially once our surgery is done, um, then leave them on oxygen for at least 5 minutes. I'm just gonna breathe our full oxygen. If you work at a practice that has medical air, that's even better. So definitely utilize that with a combination of oxygen, but most of our clinics just have 100% oxygen. So I'll utilize oxygen. After you actually have 2 full swallows, deflate your cup with your syringe that you have and remove your ET tube. Just make sure that there's no blood or discharge or anything like that on your ET tube. And then you can go ahead and discard your ET tube. Um, and just depending on the practice that you have, obviously our original intent or best intent is to have a brand new or sterile ET tube for each patient. So they do have sterile endotracheal tubes that you can get that are made out of silicone. So you can sterilize your ET tubes using your steam autoclave that you can purchase, or you can throw away your ET tubes after use and use a brand new ET tube for each patient. So that just kind of depends on the practice that you work at. There are still a bunch of practices who just clean in between uses and hang them up to dry. But trying to change kind of and evolve in between our practices now. We would really love to be able to, get as many practices as possible to kind of switch over to utilizing those silicone ones at least and sterilizing them in between or switching over to the brand new ones. So that's the ideal within the next upcoming years would be great. So I'm not going to show you just a video. We're going to kind of move through because I know you guys know how to do that, but that was actually just for school purposes. But our recovery area should really be just a separate quiet area dedicated just to anesthetic patients. Try to keep that area quiet. Even if you turn down the lights, that'd be great, especially for our animals that are had ketamine or tilazol. That are just really sensitive to lights would be fantastic. We should have dedicated staff, at least with one technician just in that area to monitor these patients solely and just have it stocked with emergency drugs, equipment needed, any type of reversal agents, pain medication to keep these patients comfortable while they're waking up. If they have their dedicated cage already available, that's fantastic. There's a lot of times where we have these animals waking up on the floor, which can be okay as long as it's in a safe environment and you do have technicians that are available to monitor them at all times. So it just kind of depends. Um, and it and so yeah, and making sure that if they are still intubated, that someone is available to be there at all times until they're completely extubated. Brachiocephalic breeds, obviously, they're prone to more post-anesthetic complications. So we want to leave in their ET tube as long as possible. They definitely love having that ET tube in, and that's the pretty. I like to say it's the only time that they're actually able to breathe really well. So they will definitely keep that ET tube in themselves for as long as it possibly can. So a lot of times they'll be sitting up and looking around for with that ET tube in. So just let them take their time and have their moment where they're able to breathe, and just let them really wake up fully, just to make sure that they're not going to have any post-op complication. Hypothermia, just as you know, can really decrease that metabolic activity and their body functions of their heart and their brain. So we really want to be careful for these guys. Mild hypothermia is somewhere around 97, but it's still really low in my book. But under 93 degrees can be really fatal. So we really want to work towards keeping them normal thermic normothermic. I mean, I've seen it where 93 degrees comes out just from a spay or even a neuter, which is pretty unacceptable. And we need to keep them, at a pretty reasonable temperature. Not having heat support on them just because it's just not available at the moment is not okay. Or you think it's not going to take that long in surgery. We need to have heat on them at all times. So some factors for being hypothermic is that we shave them and we scrub them, the length of the surgery, and that the fact that they're open body cavity, it makes them cold. The drugs obviously that we use, and the fact that we have cold inhaled gases. Yeah, oxygen is really cold, so turning down their oxygen and knowing the flow of the oxygen that they should be on is really important. If we turn all of our animals at 1 to 2 liters of per minute, that's not really helping our little tiny patients. We're wasting oxygen and then we're making them cold for no reason. Um, Decreased muscle shivering, obviously, if they're not shivering when they're cold. I'm sorry, if they're not shivering while they're asleep, then obviously it's going to make them colder. And then the temperature of the fluids given, the fluids are really cold, just like if you go to a urgent care and you're placed on fluids, you get cold really fast, regardless of if you think they're at room temperature or, that they're probably not that cold or they're going at a slower rate. It's still really cold for them. So having a fluid warmer is really important, and placing it in the right area is really important. So treatment for that, obviously, we can have warm blankets, but warm blankets aren't enough, honestly. So heating those blankets can be really beneficial. Bear huggers are fantastic. Warming IV fluids is great, but by the time it gets to the patient, it's probably not helping 100%. Snuggie safe discs are good, but we have to be really careful with those guys too because it can burn the patient if you're not careful. So just keep that in mind. Sacks of rice, lentils that are heated in the microwave, again, being very careful with those. They're not veterinary safe approved, so just being careful. Warmed inhaled air. So obviously in certain cases you can have anesthetic machines that have warming units on, your gas inhalants, which is really nice. Warm water bottles, bags, gloves that are placed around the patient, which again, you have to be really careful with so you don't burn the patient. So you have to obviously replace those too as you go. And then you can have also some like leaking fluids around it too. So being careful. Now, warm water enemas and then warm abdominal lavage. Warm water enemas are for animals who are really, really hypothermic in emergency situations, stuff like that. So it's not something you just go to right away. Warm abdominal lavage, again, for animals that are really hypothermic, or when you're thinking about doing abdominal lavage at the end of your surgery, like say you have you're doing an exploratory or something like that, you're not going to pour cold fluids in there to lavage out an abdominal cavity. So you would like to warm up your abdominal, or I'm sorry, your saline and stuff like that. So that would be great. You have to be really careful that you don't warm it too much, of course. So also you want to avoid thermal burns at all costs, so just be really careful. And like we said before, bubble wrap is really, really awesome to use as well. So warm air blankets. So as you can see here, we have our bear hugger and the first picture on the left. That's surrounding our patient. That's really nice. It kind of goes underneath the patient as well. In the middle picture there is our hot dog, which is nice too. You can kind of wrap our patient in that. And then in our last picture here is kind of cool. They have the bear hugger that's underneath. And what they did here is they have our like aluminum blanket that also wraps up the patient as well. That works really, really well to kind of insulate that patient. This patient's on the ventilator too, as you can see there as well. So that's kind of our long-term patient protocol. So Um, so another thing too is being careful of vomiting and regurgitation. So if our patient acts like they're going to vomit, to get the head below the thorax so they can't inhale that vomit or any type of regurgitation aspect. So just utilize gravity, obviously. So making sure that ET tube is inflated at that time, making sure that you rinse out the mouth really well or using suction. And then we need to make sure that we're doing further workup as well, just to ensure that they're not having an aspiration pneumonia. So, radiographs, antibiotics as needed. And when's the best time to do those radiographs? Do you do radiographs right away? And so when is that best time to ensure that no aspiration pneumonia has really happened? So if you're thinking after 24 hours, you're on the right track. So right away, you're not going to see the signs of aspiration pneumonia. But if you're looking after about 24 hours, would be a good indication of aspiration pneumonia or not. So here is actually sign of aspiration pneumonia, yes, but what type of aspiration pneumonia? This would be if you were giving a patient a barium study, and this patient either regurgitated or vomited up barium and then aspirated that barium, and you're seeing the barium that actually is really taking a nice view of every little aspect of the lungs as well, which is not very good. So, but that would be aspiration pneumonia of barium. So emergence delirium is what you see after, or I guess during excitement phase. So this would be during stage 2. So it contributes to, multiple different types of medication. So you are seeing that with opioids and dissociatives. So this would be, where they can hurt themselves. They are definitely not really understanding what's going on during this time, right? We have to kind of treat it with the calm voice, avoiding those light and sound. Avoiding light, loud noises, all of that. So, and yeah, they just kind of don't know exactly what is going on at that present moment. Dysphoria kind of happens for a longer period of time as they are truly waking up, but emergence delirium is that excitement phase. And prolonged recovery is due to patient-related causes, obviously. So whether it's shock, hypoglycemia, hypothermia, whether or not they have a concurrent disease like liver disease, shunts, stuff like that. If they can't metabolize medication, stuff like that, cardiovascular disease, and also intracranial pressure. So head trauma, that you're noticing that Cushing's reflex, stuff like that. And even craniotomies, if we have that too, hit by cars, a lot of different shock cases that could potentially come in. So we saw obviously a lot of that in our ICUs that would come in too. So it just takes time for them to recover, but it's definitely critical time during that phase. We can patch them up in surgery, but it's a matter of that recovery of how they're going to do. So I'm not going to go through this aspect of things. So that prolonged recovery, this is where we really need to kind of keep an eye on their perfusion, right? So their blood pressure. So if they're having poor perfusion, is it due to the fact that we need to give more fluids? Do we need to give colloids, whether it is head-starch, metastarch, blood even, do we need to check their PCV? If their PCV is normal, what is their total protein? If their total protein is low, just slightly low, maybe we just need to give some high-starch. If we need to give plasma even, do we need to give whole blood, packed red blood cells? What do we need to do if their blood pressure is low, if they're shocky, where their perfusion's really bad, then, we start with crystalloids. If they have Cushing's reflex, so intracranial pressure, what do we do at that point, right? So intracranial pressure, meaning that there's some type of swelling fluid on the brain. We need to pull that swelling out and put it back into the vascular space, right? We need to pull out that fluid and put it in the vascular space. So how do we do that? We have to take that diuretic, so mannitol, and give that mannitol to that patient. So we give that just a mannitol for 20 minutes, and then recheck our blood pressure, and hopefully it's kind of evened out. Our heart rate is increased, our blood pressure has decreased, and we can go on our merry way a little bit, right? Still going to be touch and go, but hopefully it's better. And then what fluids are you going to give? So that's kind of what we talked about. How are we going to work from there? So it really is kind of a fun, for me, it was fun working in ICU because you get to think, you get to be the critically thinking one too. You're working with the doctor hand in hand, and a lot of times they ask me my thoughts on it. Hey, what are you thinking? What do you want to do? A lot of times the doctors are like, I don't really know right now. Oh, let me think about it. And then I would say, well, what do you think about this? Like, can we try this? It's totally about a puzzle here, right? Um, and a lot of times they're like, yeah, that's not a bad idea. Or I don't know. I don't know if we can do that because we have to think about X, Y, and Z. And then I go, oh yeah, right. And so it's totally a great learning experience. Hypoglycemia. So are we treating for an underlying disease as well? Or are we treating just because they're hypoglycemic for, a reason of just they haven't eaten for a while? So, if we're treating for another underlying disease, maybe just treating as a band-aid until we can fix that underlying disease. Or if they haven't eaten for a while, then we just, do this for a little bit until we can get them to eat. Or do we feed them yet? Like, what can we do, right? So that is one type of thing. Let me just make sure I didn't miss. Okay. So complications too. So monitoring parameters. So eating and drinking. So watch for vomiting, diarrhea, anorexia. Checking our wounds daily, right? So looking for redness, swelling, discharge, firmness, bruising. Checking for excessive, prolonged bleeding, fluid buildup, inflammation, and then dehiscence. So our magic number, so is day 4. So on day 4 is the day that we could have dehiscence, all right? So that was always the number that would be like, the wound is opening, and it's been 4 days since. Yeah, they need to come in as dehiscing. So keep that in mind. So surgical complications, right? So here's our pain, hemorrhage, seroma, hematoma, dehiscence, self-trauma even, and infection. So you have this big bulge here, and then look at, you're getting fluid back here. Could be infection, it could be a seroma, it could be a hematoma. And so, if it's warm to the touch, if it's painful, you're just kind of working through the issues, and then you get fluid off of it. You gotta look at the fluid. If it's a infection, we're gonna have to drain it or open it back up. But if it's a seroma, then we're gonna treat it differently. So that's why we have to look at it a little bit more in depth. And then having a pain score. So this is really important too. We have to know our pain score and like what our animals look like here. We have to be able to tell owners what pain looks like in our dog, right? And so they may go home and think, oh, my dog is laying down. It's totally comfortable. But truly their dog is painful, right? So, or their dog is just sitting here. Maybe it's maybe that's comfortable too. Or the dog's laying here, that could be comfortable, but it's really not comfortable. So we have to be able to let them know that that's not comfortable. Same thing with our cats, right? So the cat is, laying here. Well, maybe it's laying here or here or here. They don't know. So we have to be able to give them resources to be able to know like if their animal's comfortable or not. And here's a really good one too for mice or even rodents as well. So how do we know? How do we know if rodents are comfortable or not, right? So this is a great tool to be able to know like, hey, our little guys are painful. They get painful too. So to be able to tell owners like your little tiny one is in pain as well. So hemorrhage. So coagulopathy issues. So we have von Willebrand's disease, rodenticide toxicity, which happens really often, more than we think. Severe liver disease happens quite a bit. Autoimmune platelet issues, so ITP, Rocky Mountain spotted fever, depending on where you're at, and obviously toxicity issues. So things that come in and things that go through your mind that what it could be, obviously. So von Willebrand's disease is common, but not as common as we necessarily think. Typically, we catch it as ahead of time before it actually truly does happen, I think, nowadays. Rodenticide happens quite a bit, as well as severe liver disease and ITP and IMHA and all of that. And how do we treat that? So coagulopathy issues, the nice part about that, and same thing with rodenticide toxicity is, say they are bleeding out and they're bleeding out into their abdomen, what we can't do is we can auto transfuse. So that's the nice part. So if they're bleeding on their chest or their abdomen, we can tap their chest or their abdomen and give that blood right back. There's nothing wrong with the actual blood itself, the red blood cells and plasma. There's just not going to be any coagulation factors in there, right? So we'll be able to give that blood back. We just are going to have to give them some sort of clotting tools for them, right? Vitamin K, and maybe if they need platelets and stuff like that, they're obviously going to need vitamin K. But they're going to obviously need blood as a band-aid for that right now. So now if they have ligature slippage from, surgery and stuff like that, then, we'll have to work that through and find the slippage and go from there too. So we'll have to go back and figure that out, and give them blood and check for sterile PCVs and all of that, and work our way back from there. So obviously I've seen that too. So here is just a little bit on a fast scan. So fast scans are ways that we can do a quick ultrasound to see if there's any kind of fluid within the belly. And these are things that we can do as certified vet techs that are pretty easy. So you don't have to be an ultrasonographer to be able to look for fluid in the belly. You just have to be able to look at 4 points within the abdomen to be able to look for fluid. So you're essentially taking the abdomen and looking in a diamond shape on the abdomen. So you're going to look at the cranial aspect of the abdomen, so around the liver. Then you're going to look at the two sides of the abdomen near the kidneys, and then you're going to look at around the bladder, and you're looking for any type of fluid in the abdomen. So she'll show you how to do that. It's a really good tool to be able to use to just rule out any type of fluid in the abdomen. So I'll show you.
Each side is positive for free fluid. And this one's complicated because there is a splenic mass there. And free abdominal effusion as well. And again, free fluid is present there as well. So urinary bladder is here, and then free abdominal effusion. So we want to get the hepatorenal site, which means we want to get our kidney in view right there, and then we're getting our liver.
Awesome. So that is exactly how you do your fast scan. And then a big part of that is once you get that ultrasound guided free fluid, abdominal prosthesis, typically that blood will not clot. So that is a big indicator that you have obviously gotten your abdominal prosthesis correctly. And then you can kind of take a look at that fluid as well to just see what's going on. So another complication that you'll see is seroma or hematoma. So we've seen these, obviously, some neuters you'll actually see, or you've seen animals who have constantly licked certain areas and caused a seroma as well. And typically we will treat these with antibiotics or anti-inflammatories, warm compresses, warm moist compresses. Obviously, we have had to drain them with syringes, needle syringe, obviously, or done surgical with like hematomas that are really big. Sometimes you have to go in and make sure that there are no slipping of any kind of ligature that's in there. We actually had to do that for a neuter before there was a slip of ligature, and the patient actually had to have a blood transfusion due to it. So, so yeah, it's important to take it seriously. Just because you've seen a hematoma or seroma, especially of the scroll sac, doesn't mean that's not a big deal. It's warranted to take it seriously. Sometimes you have to put a pressure bandage on whatever seroma or hematoma that's there, just depending on where it's located too. So keep that in mind as well. And self-trauma. So licking, excessive licking, instinctual, it's an instinctual behavior, and some animals do it more than others. Sometimes as well, it's a self-soothing behavior. So also scratching, rubbing at the surgical site area, and can also be an issue, and then it just delays healing, and it sets it up for dehiscence. So that's why, obviously recommending to utilize whether or not it's an e-collar, depending where it is on the body, or t-shirts, and they even have like commercially available kind of like t-shirt wraps kind of things too. So utilizing those things as well. And then suture reactions happen more often than we think, and that might be also a reason why animals lick at those areas or are bothered by those areas. So we have to keep that in mind. So more warm, moist compressors, cleaning that site with just a dilute antiseptic solution. It may require surgical debridement. I just had a coworker who had an allergy to Sterabond, and she had a knee replacement, and she just they had to go all the way back in and debride all this necrotic tissue, and actually had to debride out part of her knee capsule because it was so bad. So she's going to have 8 more weeks of recovery due to it. So it's a big deal that we should take a little bit more seriously, especially other animals too. So, and then systemic antibiotics with any case obviously may be required. So, and prevention of self-trauma, just like we talked about. So e-collars, a bandage, t-shirt, socks sometimes. If we have to, basket muscle, obviously, which kind of sucks, pain management, or anxiolytics, so like trazodone, gabapentin, anything like that. And have fun with e-collars and stuff too. I think it's really kind of fun, or t-shirts and all of that. And there's nicer e-collars out there now too than what we have previously had before. Infections. So hallmark signs of inflammation, or cardinal signs you might see of inflammation. So that would be pain, heat, redness, loss of function, and swelling. So these are really, really, really important things to note for your boards. They are definitely questions that I have seen in books and stuff like that that you need to know. And these are definitely things that I had to know, I remember. So pain, heat, redness, loss of function, swelling, and could be discharge too that comes out. So yeah, this is definitely a sign of infection. Not fun. I can imagine that is painful for sure. So here's a video here that I wanted to show you guys. Okay.
This poor cat got outside and was...
I'll tell you, before we get into this more, I do like to show videos of things that I don't necessarily agree with, or things that we can talk about, I should say, conversation piece. So watch and then take a note, and then I'll discuss some of the things that this guy and I have differences on opinion, I should say. So many of my students have seen videos with him, and we've had conversations in class about. So just take note. But there's a reason why I showed this video, so that we can have a conversation about. So enjoy.
Probably bit, and you can see bite wounds on the outside, and of course they need to be cleaned up.
So if you look deep in the wounds there, you can see all those white things moving around. Those are fly larvae or maggots. A lot of people mistake those for worms, and they're maggots. But the cat's not actually anesthetized. It's just laying there because it's so depressed. And our assistant's helping me get them out of there, and you can see it's really hard to get them out. We flushed most of them out. Tried to flush them out with some peroxide. And those things are tough. A few of them came out, and after we did that several times, we got most of them out, but we still had to remove a few during surgery. So there's one escaping now in the foam, and as I pull back, you can see a couple more deep inside the wounds. It's always important under anesthesia to look deep into the wounds of any severe wounds like we have here and make sure what's happening. You can see the maggots that are left still doing their job. And actually, maggots clean up all the dead flesh.
Actually, once we took it, you'll see the tissue from the original dog bite I cut out. And here's a lot of the dead tissue from inside. And we flushed all the maggots out. You can see though, once we get the maggots out, the fat is now glistening and it looks pretty healthy. Pull it together and then we'll just keep suturing it up with these sub-Q stitches until we close it. And we separate it into thirds to start, and then we just keep putting in stitches until it's closed. But it's a pretty big wound, but cats are the best healers in the world and it should heal up. Yep. With the sub-Q stitch, we go in from underneath, come out the top of the skin, pull it up, grab the needle, put it into the skin on the other side. And then usually what we do is to eliminate dead space, take a little bit of a bite in that fat. See that healthy fat? Doesn't it look a lot better than it did with all those maggots crawling around in there?
Yes, it's nastiness.
Nasty. So we're gonna pull the suture tight, and we're gonna leave a pretty good drain hole. We'll probably leave it open that much to drain because when it was so infected, we don't think we got all the infection out for sure. We did get all the maggots out though because they were nasty.
For infected wounds, we always put a drain in to make sure that all the infection goes out the holes we want it to, and it doesn't get locked up in there and go through the incision. It lets the incision heal around an infected area, and the infected area gets smaller and smaller as the drain, as the infection seeps around the drain. So that's what drains are for. Well, I hope you were able
All right, so going back to our slides. So where to start? So with him, he mentioned, washing out the maggots and that the cat wasn't under anesthesia. I hope he gave that cat some pain meds or something prior to beating it with everything. Having maggots, I can't even imagine how uncomfortable that is, and having to have someone pry out all of those maggots and everything. I probably would have tried to have that cat under anesthesia to do all of that. It probably would have been a lot. It would have been a little bit more helpful, I think, to just do that all under anesthesia. But whatever. So when he put that cat under anesthesia, if you noticed in the monitoring, the cat's temperature, even before starting the entire procedure, was already 97.9 degrees. And so he still had a lot to go with, of cleaning up that wound and then suturing everything back up. So the debridement takes a little bit of time, and then flushing it, and then suturing everything up. So post-operatively, temperature-wise and all of that, I wonder what that cat was like. It makes it a little bit worrisome. So I can't imagine. The cat was probably at least 95, 94 degrees, which is a laceration, or I'm sorry, is a bite wound that's infected, that's pretty bad. So that cat is already pretty critical. And I hope he gets some IV antibiotics. I didn't actually see if that cat was on any IV fluids or anything to that matter. I'm glad he had it intubated. I've seen videos where they're not all intubated and everything. Now for surgical attire, as you noticed, he was only wearing gloves, so he didn't have a gown on or mask or surgical cap or anything to that matter. This is a kind of a weird case because I would say because you're in your surgical suite, you should be surgically prepped with a cap, mask, gloves, regardless of who you are, right? Or cap, mask, any booties, whatever. Um, and because he's the surgeon, he should have, of course, his gloves on. If he were doing in the prep area, because it is a dirty wound, he could have done like a laceration repair or this even bite wound outside of the surgical area. But he was inside the surgical area, so I would have said, yes, wear a gown, but he wasn't. So it's kind of one of those gray area things because it's dirty um, of a wound. So it's already infected to begin with. So that's a little bit weird. But normally he doesn't wear gowns in his surgeries and stuff like that. So it's a very old method of surgery. Also, his drain that he placed. Drains are great to work with when you have a large uh, body that is your skin is not tacked down, right? So there's a huge area that you that could just slough off there, right? So he wants to make sure that all of that area that is potentially infected can drain out appropriately while he's giving antibiotics. So the unfortunate thing is that you need gravity to work in this case. And so he didn't find a great spot for that area to drain with gravity. He essentially aligned that drain up so that it works across the entire back. And so it's not going to be able to drain appropriately. It's just going to swim right on top of the back. And so my worry is that even if there is drippage, it's not going to drain all the way down. So his drain might not work 100% that well. So whenever you put in a drain or whenever you think you're putting in a drain, you have to find the best way for that drain to drain going down, whatever direction. It has to work with gravity. So yes, I like to show videos that are really good and then some videos that are questionable always. And he has a lot of really questionable videos. So if you ever look him up, sometimes you just want to smack your head. Infection, obviously. So you can have superficial infections. So where they're just poorly healing, it's like kind of a draining wound. It can be treated topically or systemically as well. My best one is that I used to play softball. I played until I was about 28, but I used to play in a men's league, and I'm not I'm about 5'4", and I was probably like 120 pounds, so I was really small. And obviously I'm a girl, so didn't quite fit the bill for the men's league, but I wanted to prove my worth in playing, so I decided that when I was playing that I was going to slide on a bunch of limestone, which is not a good idea. So when I did, I tore up my ankle sliding, and I didn't want to show that I was like bleeding at the time. So I just took some of the dust and I put it on my leg. Because at the time I was like, yeah, it'll just be like quick stop, right? And stop the bleeding so that I can keep playing. And it stopped it from bleeding at the moment, but it ended up getting really infected. Which everyone at work was like, you're really dumb, Beth. I can't believe you did this. But I was probably like 25 at the time and still really dumb. And so yeah, and ended up having, again, that like draining wound, all of that jazz. And ended up just treating it topically and systemically. And it cleared up. I have a great scar from it, but that's okay. So just think of that superficial wound like Beth had from playing softball. Really dumb. None of the men ever slid though. It was just me. Um, so subcutaneous. So if we have an abscess that forms, so thinking of, you know, happens a lot in rabbits and cats, right? They have an abscess that forms, and we have to break it open and it drains out, and we lavage it, give them antibiotics. Peritonitis is an abdominal infection, which is really nasty. We have to do like a lot of times with peritoneal lavage, or obviously going into surgery, and small intestines. A lot of times they'll just look really angry. Anything else in there looks really angry, just depending. One big peritonitis one that I saw was a um, black lab who came in who ate a needle, like a sewing needle, and it went just a nice hole right through his small intestines. And I gave an estimate to an owner for $17,000 to fix this dog. And the guy didn't bat an eye, and he fixed his dog. But yeah, it was quite a mess to fix that just little tiny hole that needle went through his small intestines. So yeah, it was crazy. And then pleuritis is a thoracic cavity infection. So obviously more serious, worse prognosis, but the one that I had was like a chylothorax. So this was a cat who we actually did surgery on, took it to surgery. It was completely dead through surgery, and took it to surgery, had coated in surgery. We opened up his chest, lavage out the chest, got all the gross, pus out of its chest. And sure enough, that cat lived. It had no heartbeat or anything throughout the surgery, and we gave him a bunch of drugs throughout surgery, and he woke up. He didn't have any vision for about a day and ended up living and did really well. So it's kind of our little Hail Mary, and somehow lived. So but these guys are, I mean, cats are crazy and how that they work out, but it doesn't always happen that way. And then septicemia is really bad. It's way more serious. It's a generalized infection that spreads throughout the bloodstream, and it's not necessarily as very common post-operatively, but really it's more common obviously in the ICU, if we have patients that are extremely sick, obviously. So um, it's animals that are really sick and dying. So it just kind of depends, but it doesn't always happen post-operatively. So wound dehiscence happen when there's suture failure or extreme like reaction. So like I said, this happened obviously to my friend, where she was allergic to the bonding that she had. So she had a wound dehiscence that happened. So that tissue weakened. And it just happens, due to like whatever the age is, debilitation. Can happen to Cushing's patients a lot of times because they're on steroids. So thinking of steroids too, steroids prolong healing time. Whether you have mechanical stress, so you can have a rough recovery. If you have a chronic cough or vomiting, if you yourself refuse to stop your activity level. So say even like you have an animal at home that you're not resting, then you can have wound dehiscence, or if you have self-trauma. Also another thing is poor nutrition. So as you guys will learn, I am way big into nutrition. So and my students also know too, like we bumped up our animals' nutrition after they had surgery, or they were supposed to, I should say. So they would come in and they had their regular nutrition, and if they had surgery, we bumped up their nutrition to, 1.5 at least their RER requirements, compared to their. I'm talking about, yeah, I guess cats and dogs, compared to their 1.2 RER requirements, which we'll talk about nutrition later on. But we always bump up their nutritional requirements because they are recovering from something. They need more energy to recover from something during that time. Um, and they need good food too. They need to have good quality food to be able to recover. They should always have good quality food, but just saying. Debridement and wound care. So I was actually exposed really early on in my career, and I say early on in my career, literally early on in high school, to debridement and wound care for many patients. We took care of a lot of dogs from the Humane Society and shelter animals that were hit by car and all of these interesting animals. So I got to do a lot of wound care and everything. So I was really lucky in seeing how wounds healed and bones healed and stuff like that, and just doing anything that we possibly could to help these animals. So, it really does help. I actually, during my time too, helped with an animal who got bit by a brown recluse spider, and um, this dog lost, gosh, probably, oh, the majority of the side of its body. It was a boxer, and we were able to do skin grafts for some of it, but all of its skin grew back. So it was pretty awesome to be able to do all of that wound care and some skin grafts. But the dog lived rather than giving up, and saying we couldn't do it. So it took a really long time and patience, and the owners believed that we could do it, and we did it. It was awesome. But um, we we just promoted that wound with second intention healing, right? So first intention would be to be able to close that wound right away. But second intention healing is to be able to granulate that tissue in. So we have to slowly kind of use that scalpel at first and debride it a little bit. We used water therapy for that kind of stuff. So we wet to dry bandages, any type of collagen promoters, antibacterial stuff. We use a lot of honey. Neosporin SSD cream at times, but a lot of honey we used. Sugar bandages as well you can use. So any of those types of things to do bandaging. And then always remember your post-op analgesics is really important. So making it pain-free. If they're painful, it's going to delay healing process. So watch for any type of breakthrough pain too. Just because they're on, pain meds already doesn't mean that they're not going to have breakthrough pain. So you might have to do a CRI, and then on top of it, do buprenorphine, right? Something to that effect. Also, remember you can't do fentanyl and buprenorphine at the same time. The buprenorphine will reverse the fentanyl. And then your IV catheter, make sure you're flushing every 4 to 6 hours, and make sure you use an aseptic technique. And then you don't need to necessarily replace it every 72 hours as long as the IV catheter is not showing any signs of phlebitis, the animal's not chewing and licking at it, that kind of stuff. And rewrap it, the tape, every 24 hours to prevent it from being too tight. Like rewrap every single piece of tape. Take it all the way down to the bottom. Clean it with chlorhexidine, the catheter, the animal skin, everything, to prevent it from getting infected or anything like that, and then rewrap it loosely so that animal's leg doesn't get too tight and bad. This is just going to show you, I'm just going to flip through these because I know you guys learned that already. But male urinary catheters, female urinary catheters, that kind of stuff. So we'll talk later about nutritional support. So this is how you calculate your RER. It's your 30 times kilograms plus 70. So depending on the surgery that was performed, patients have to have their caloric demands increased, and you can do it up to 2 times their RER, right? So depending on what it is. So say like your neuters and spays should be at least 1.5, right? So your normal procedure should be 1.5. If they're having anything additional like redone, so say, you know, a orthopedic surgery or, you know, something bigger done, it kind of depends from there. So you may have to bump it up to 1.7 or 1.6. So just depending on the animal. Now, granted, if this animal is already overweight, we may have to just keep it at 1.5, you know, or whatever until they heal. So it kind of just depends on like what everyone thinks they should be on, but they should be at least at 1.5 until they heal. But we don't necessarily have to be at 2 times, and it's really patient specific. Now, if they do need an appetite stimulant, we can start them on an appetite stimulant to get them to eat right away or whatnot. We need to get them to eat. But also remember that if they're not eating right away, it could be due to the opioids that they were given or anything like that. So if you haven't given them Cerenia, they could just be a little bit nauseous from everything that was given. So you may want to start, you know, Cerenia that day first. And then if they haven't eaten still, we might need to put them on some appetite stimulant from that. So whether it's IV diazepam for cat, you may, for dog, give like a 1 mg per kg dose of propofol, which is a great appetite stimulant. Have your food ready because it doesn't work. It doesn't last very long. So mirtazapine, obviously, is really helpful. Cryoheptadine. Corticosteroids can be helpful, but not my first choice, I guess I'd say. And then acupuncture might be a really helpful option as well. So what happens when they go home? So this is kind of my fun category, talking about what can we do now rather than just giving them anti-inflammatories and saying, here you go, good luck, right? We have so many different options now that practices are doing that is really fun for the owners, it's bonding time, and this is a great opportunity for animals to have a chance to recover and grow their strength back, and lessen their pain with less side effects, right? So doing physical therapy, laser therapy, icing heat tens, which is fantastic, massage, range of motion, acupuncture, and chiropractic care, right? So I'll just kind of show you a video just explaining a little bit of it. And we're going to go from there, and I'll leave you some other videos as well later.
My name is Kate Reynolds. I'm a veterinarian and a certified canine rehabilitation practitioner, and I've been here for 11 years.
My name is Jennifer Quinn. I am a rehabilitation therapy assistant. I've been with Union Lake and the Rehab Center for just over 3 years now.
The Animal Rehabilitation Center of Michigan was founded in 2001, and it was the first of its kind. It was founded by Annette Engler, who manages our facility.
She always believed in being a pioneer in her field and was able to restore quality of life to hundreds of pets other people had pretty much given up on. And since then, it's really become a labor of love.
We treat all kinds of injuries. We do a lot of orthopedics, which are helping heal bones, ligaments, tendons, and joints. We will help pets recover from neurologic injuries, which deal with the brain, the spine, and nerve issues within the limbs.
We also do conditioning and weight loss programs for overweight dogs, working and sporting dogs. We also do a lot of work with the elderly animals, helping manage pain and keep them mobile while they age.
So we're helping animals to do better with their activities of daily living. We're helping them restore function. We're helping to decrease pain. And we're helping them just to be able to live their lives in a more normal manner, whether they're recovering from injury or if they're having an issue that's going to be a lifelong problem.
Most of the patients we see, their owners are quite surprised by how they leave the facility when they're done with their rehab. One was a 6-year-old dachshund that we had after she had disc surgery in her back. She was accidentally jumped on by a larger dog. The doctors only gave her about a 50% chance of walking again. She now can walk and run, and we go outside and do exercises and snuggle, and she's just been amazing. Her mom just wrote us a nice little thank you for Thanksgiving, saying that was truly a miracle. Even her doctors are blown away by the videos we send. So it's a testament to what love and a lot of hard work and slow and controlled reintroduction of exercise can accomplish.
So that's just a little preview about what rehabilitation really can do and be like. And it's really kind of a fun specialty that can be done. That, I mean, I just enjoy learning more and more about it from people that do it. So this is a really great video too, to kind of shortly show you guys what acupuncture is like. My little story about acupuncture is that I worked at a facility that did acupuncture, and I was helping with acupuncture on a Doberman who came in who could barely walk when he came in the door, and he had wobblers. And I helped hold for them to get acupuncture started. And so they said, okay, well, can you just like stay in here and watch him for like the next 20 minutes as he's getting his acupuncture. And so then they came back in the room and removed all of his needles and everything. And he got up and he walked out, all excited, and he left like he was a completely normal dog again. And I was just like, oh my gosh, I can't believe that. And I actually suffer from chronic pain issue and all of that. And I was like, I'm blown away. I now have to try acupuncture. And sure enough, like it really does a crazy thing, So I was like, I literally am gonna try this due to what we did at a veterinary hospital. But it's just amazing. So I'll show you this video really quick, just again a little summary of acupuncture, and then I'm just gonna show you a video in a different section too of a TED Talk as well, to give you guys an idea of what acupuncture is really like, and it explains it a little bit better. But
People may not immediately put acupuncture with veterinary medicine. However, acupuncture from a veterinary standpoint has probably been almost practiced as long as that for humans.
But this horse just came out of a field where it's been raining and there's mud out there and manure up to its ankles. And it's going to go back out there after we treat it. So we're probably not going to use it. Sometimes the addition of acupuncture helps me to do a better job, and sometimes it's the only thing that gets us over the hump to get that animal better. As far as things that we treat most often are the things that respond the most. So musculoskeletal problems, so we're talking about pain, nerve damage, and that's because that's a lot of the things that acupuncture is good for. We're looking better on the straightaway. Acupuncture stimulates the body to heal itself. Pretty much it in a nutshell. Those veterinarians that are skeptical, they're doing it in a sincere way. They want to do what's best for their patients, and they don't want to recommend anything willy-nilly.
She drinking any excess water? Yeah. More than normal? Yeah. Okay.
As far as a placebo effect in animals, that's not possible. What is possible is a placebo effect on the owners, because the owners feel that just because they're paying for it and having something done, it must surely be having a positive effect. So one of the responsibilities as veterinarian acupuncturists is to filter that part out and actually look at our patients, see what's better, and then ask good questions.
Meloxicam help?
Some, it makes her more comfortable.
We do know that when needles are placed, those needles are stimulating a neurovascular bundle. You're getting the release of endorphins and enkephalins, histamine release, and a lot of things that we know from a physiologic standpoint are involved with decreasing pain, decreasing inflammation. I'm having some trouble.
At the end of the day, whether you can explain it from a Western medicine standpoint or Eastern medicine standpoint, if you're getting results, then that tells you the evidence that you need to know.
So just remember that every case is case by case. So, you know, whether we treat them just by acupuncture, just by physical therapy, or if we use a combination of everything, um, you know, it is case by case. But what we do have to do as professionals is that we have to remove our own biases, because if we keep our biases for in front of our patients, we aren't able to actually treat them to the best capability that they are able to receive. So that's what's really important. And as we have seen probably in our own world of healthcare, you know, what has been maybe offered to you or offered to someone that you care about may not have been the full idea of what, or the full aspect of what could have been offered. And is it due to biases? We don't know. But it would be nice to always get, you know, every option that's out there for someone, right? So keep that in mind when you are out in the field, to give every option for your patient that is potentially out there, so that they can choose for themselves, you know, educate them on everything that they can potentially utilize out there, and try to remain unbiased by it all, because that's what's fair for each patient. And so, you know, discharge is really important. We talked a little bit about discharges already. So it tries to help ensure that owners stay compliant. If we just tell them verbally and hope that they remember everything, that's going to be really difficult. You know, that would be like me trying to tell you guys everything verbally, and think that you guys are going to remember every single little aspect of things. And that's a little crazy. I can't expect that of every single one of you. So thinking that our owners are going to remember everything is really, really hard. So try to write things in clear instructions, written, verbal, checking in on them even, right? To go over things again. You know, that's why we have call the next day and say, hey, how did your first night go? You know, do you have any questions about anything? That kind of stuff, right? Schedule a recheck appointment too, like that day. Say, let's set up your recheck appointment for, you know, 2 weeks from now or whatever it is. Whether or not they have to come in for their suture removal or not, you know, schedule a recheck appointment to have them just make sure everything is good. Go over the medications. All right, when should they start their next dose? Tell them exactly when they should start their next dose. Go over their feeding instructions as well. All right, when's their next meal? How should they feel their next meal? You know, the anesthesia is a little bit different. And so when should they start the next meal? How should that look like? Which food should they feed? That kind of stuff. Owners need to know specifics. What to look for with the incision. Show them the incision of what it looks like currently right now and what it should stay looking like, right? Owners always ask too, how should I wash the incision, right? They always ask that. So like tell them you don't have to wash the incision unless obviously something gets on it, and how should they wash it if they need to, you know, just rinse it or whatever. And when to return if there's an emergency, who to call, obviously, if it's an emergency, to wear the e-collar or what special instructions that they should have. Discuss the confinement. So no running, jumping, leash walks only, right? No baths until sutures are out. All right. If they need to like clean the animal up, just kind of like a warm, wet cloth type of thing. Nothing too crazy, right? Awesome. Well, thank you guys again for joining me today. And I will talk to you guys soon.